Hello friends, Dr. Abdul Khalik here, medical gastroenterologist and CEO of Umda Healthcare. Today I will be discussing one of the inspiring stories from Win Group of Hotels and Resorts, what they do differently in hospitality and what we can take inspiration from their hospitality lessons and we can apply within our healthcare industry, particularly to the hospitals or nursing homes or to our clinics. When compared to other hotels and hospitality business, what Win Group does is at each and every change of the shift of the staff, like morning shift or evening shift or night shift, the manager of the staff will be asking one question. The question is quite important. Rather than just taking what is the work that is done and what is the work to be done by different staffs, one important question he asks as a ritual for them. The question is, can any one of you can come forward and say one of a story which had provided a wow customer experience to one of your customers who came to the hotel. So by encouraging the staff will be coming forward and saying that they have done this and that customer has felt really well. So by encouraging such type of environment within the group, the Win Group is trying to make all the staff members to look for such type of wow experiences which they can create to the customers who come to their hotels. By creating it, what it is doing is it is building in the culture wherein and wow customer experience is being delivered to the customers who come to their hotels. If we apply the same to our healthcare industry, so whether it be the nursing staff or housekeeping staff or valet parking people or managers or our PREs or even doctors of different shifts, morning or evening or night, if we inculcate the habit of Win culture, that is, do you have any of the stories wherein you have walked an extra step or walked an extra mile to help or comfort the patient or the attendant? And for the staff who actually did such a type of stories, if we reward them, award them and bring in an appreciation to them among their peers and other people, that will boost their self-confidence and self-esteem to that level, and other staffs will be looking forward to do such type of service so that they get appreciated. So we at our workplace, we not only encourage our staff to share such type of stories on a daily basis, but also we do one more thing, that is we empower our staff to take some of the decisions by themselves. We empower them to give the discounts whenever they feel that the patient is really poor. They can come forward and say that this patient is really poor, so we need to give discount for the procedures or for the consultation, or even for a few cases they can come forward and say that this patient is really poor, we have to look, we should not take any money for consultation. And sometimes in emergencies also they are given the liberty to go ahead and dispense a few emergency medicines to the patients if required. So by empowering them as well as encouraging them to bring out the stories on a daily basis to discuss, then we award and reward to such type of behavior, what happens is slowly the culture of the organization, the culture of the people who are there will improve, and whoever the patients or their attendants come, they will be having a soothing or a comfortable type of human behavior or human interaction with our staff. So rather than, when compared to having a very big hospitals, very good interiors, very soft cushioning, authentic or inspiring interiors, the human interaction, the human comfort, the caring that the patients will receive from the staff will be paramount, more important. So we should all in the healthcare industry should be trying to develop such type of culture by constantly inspiring our staff, awarding and rewarding them with this behavior so that they take care of the patients, and once these patients are happy, they bring in more such type of patients. Thank you.